I was first diagnosed during my first pregnancy. My doctor told me that I am positive of hepatitis B virus. I was shocked and in denial. सुबह सभा هذا أول بيت فيها واجبة لا ما كم شهر حامل؟ 9 شهر أيوة ماما تعالي جوا جبني أباين نور تعالي جوا نشوفك في دكتور موجود لا ما
السلام عليكم.
عليكم السلام.
أنا دكتورة مروة هتابع معاك اليوم. إيش اسمك يا مدام؟ كم عمرك؟ 35. شو بتشتكي؟
عاملين أنا في مويه
موية تنزل. أي من الساعة كم تنزل؟
صبح اليوم صبح الساعة 7.
من الصباح الساعة 7. الحين يا مدام احنا حنفحصك ونشوف الحاصل، تمام؟ في الأول حفحص من بطنك عشان أشوف رضع العيل وأشوف عمره وكده، كويس؟ Sister Rani, this patient,
Yes.
check her vital signs and take investigation and do CTG for her. Investigation, CBC, blood group, coagulation profile, serology also,
Okay.
and take consent from her relative and from her about induction of labor.
Okay.
We will keep her till tomorrow. If not going into labor, we will give her induction of labor. We will start for her. If this induction failed, it will be for section.
Okay.
كويس؟
Okay.
So now send her to OP ward, admit her under doctor plan, كويس? And observe her. And put temperature chart for her also.
Okay.
And consent from her and her husband, okay?
Good morning.
Good morning.
How are you?
Fine.
I am Sister Romi. I will insert for you cannula and I will extract blood for you because you will go to admission in OB ward, yes?
Okay, sister.
Wearing of gloves is done before inserting IV cannula and blood extraction. This contact precaution is necessary for a healthcare worker in order to protect herself to any possible blood spills.
Hello, good morning sister, this is from DR. I will shift one patient, primary gravida, 38 weeks, TV leaking since 7 a.m. for induction of labor after blood report. Okay, if no progress, for cesarean tomorrow. Okay, bye.
أنا أوديك غرفة ترقية. Okay.
غرفة ايش تكون؟
غرفة 50.
الحين بقي؟ في نتيجة متى تسخن؟
نتيجة يجي بعد ساعة كده.
أيوة. في اليوم عملية ولا بكرة؟
بكرة الصبح.
أيوة. أنا زوجي ماله؟
أنا زوجي موجود برا، أنا في كلام مشكلة.
أنا في اليوم أكيد؟
اليوم الحين أكل ما في مشكلة، بعد الساعة 12 ما في أكل صوت عشان أعمل بكرة. أوكي.
شكرا.
عفوا.
I was 35-year-old back then. I was so scared. I felt like no one will not accept me. I am frightened that baby could acquire the virus.
Maria, this is primary gravida, 38 weeks, patient complaints of EV leaking as from for patient for induction of labor from midnight. So patient consent, induction consent and admission consent taken. All investigation taken, CBC, grouping, serology and all investigation center report to be followed up. Okay, CTG should be done 8 hourly. Temperature chart should be followed up. Antibiotic and velocipine and Coragen given already. It should be carried out 8 hourly.
Okay. When was the last CTG?
Last CTG finished at 10 p.m.
Oh.
10 a.m.
10 a.m. Okay. Any more preparation for the patient?
Patient for possible CS and keep NBO until midnight, till from midnight for tomorrow. If not labor, she will be for CS.
Okay, sister. Thank you. Hello, doctor. I'm calling from OB ward. I would like to inform you regarding your patient. Doctor, serology result came from laboratory. Hepatitis B positive. Okay, doctor. Patient is still having no contractions. Still no complaint, doctor. But fetal heart, it's okay, normal. Okay, doctor. We'll wait for you, doctor. Assalamu. Hello, sister. Is this from infection office room? I'm Sister Aryan calling from OB ward. I would like to inform you regarding our patient. Patient is primary gravida with chief complaints of PV leaking. Then serology result came. Hepatitis B is positive. Okay, sister. Patient is for LSCS tomorrow. I'll inform our staff and nursery staff. Okay, sister. Bye.
For contact precaution, do hand washing first. Wet hands with water. Rub hand palm to palm and at the back of the palm, interlace and interlock. Back of the fingers to opposing palms with finger interlock. Rotational rubbing of the thumbs, rotational rubbing with clasped fingers, and rotational rubbing of fingers around the wrist. Rinse your hands with warm water. And dry your hands using tissue. Close the faucet using tissue. Dispose in proper waste bin.
For contact precaution, wear gown first, from neck to knees, arms to end of waist, and wrap around the top and fasten it back around your waist. Open the pocket and wear the face shield. Open the pocket and wear the gloves. Be sure it fully covers the sleeves of the gown.
We are ready to shift the patient. Dear, this patient is hepatitis B positive. Okay, thank you.
OR staff should go to infection control department to know their serologic status.
If scheduled as elective case, infected cases are taken at the last case of the day.
Before doing surgical scrubbing, be sure to wear OR proper attire, the OR shoes, scrub suit, face shield, surgical mask, and cap. And remove all jewelries. Put amount of antiseptic solution and allow the water to run to your hands. Scrub your hands and forearms down to your elbows. Repeat this procedure a further 3 times, initially down to the mid forearm, then down to the wrist, then just for the hands, each time lasting for at least 1 minute. Wash the soap from your hands and forearms by holding up your hands with your hands elevated. Keep your arms elevated. Dry your hands and forearms with the sterile towels in the gown pack. Take the sterile gown and gently shake it off. Take care not to let anything else touch it. Ask an assistant to help pull it up over your shoulder and fasten it at the back. Take the right hand glove and place it palm down, fingers facing your body. Grasp the bottom of the cuff with the thumb and index finger of the right hand, still inside the sleeve. Grasp the top of the cuff with your left hand, still inside your sleeve, and pull the glove around you over your right hand. Double gloving is recommended to have a second line protection in case outer glove is torn.
The scrub nurse assists the surgical team by donning sterile gown and the gloves. Double glove is recommended to have second line of protection in case outer glove is torn.
Before starting surgery, doctor, we will do the timeout. I am here now. Circulate. Dr. Abdul Hamid, 37-year-old for LSCS. Any patient, any antibiotic has given doctor to the patient? Dr. Abdul Halim, what are the critical or non-routine steps?
No.
How long will the case take?
Sharp instruments should not pass to surgeons. This practice should be examined to minimize risk of sharp injuries. There must be audible announcement communication between surgeon and scrub nurse during surgical procedures.
Upon receiving the newborn, establish airway by suctioning, clean and rub vigorously to improve blood circulation. Clamp the umbilical cord before blood extraction. First sample for CBC. And second one for serology. Secure umbilical cord clamp. And cut with sterile surgical blade. Throw direct to sharp container.
Until my doctor informed me about that my baby can be protected by HEPA vaccine after birth. A series of 3 shots.
For the first minute of life, the doctor assesses the skin color, muscle tone, activity level, lung function, and reflexes. At birth, baby should receive Hep B vaccine and immunoglobulin. Disinfect the injection site, then give the vaccine at 90 degrees angle. After giving the vaccine, avoid rubbing the injection site. Throw syringe directly to sharp container. Before going out to isolation, remove gloves, followed by hand rubbing. Remove the gown. Make sure not to touch the outside part, followed by hand rubbing. Lastly, remove the face shield, followed by hand rubbing.
Dismantle the shaft carefully. Following surgical procedure, all of the instruments open for the case are considered contaminated. Do not allow instrument to dry during the transport process. So, spray with pre-cleanse before transport. Because of infectious case, the instrument must be kept in yellow cover and properly labeled. Transfer the instruments from operating room to the CSSD. Put a placenta in a red plastic bag and label the type of infection in it. Remove gloves first. During removal of PPE, your hands become contaminated. So, perform hand hygiene immediately and then go for the next. Remove gown. Turn gown inside out, fold into a bundle and discard, followed by hand rubbing. Remove face shield and dispose into the bin, followed by hand rub. At last, remove the face mask. At the end of the procedure of doffing of PPE, do the hand washing.
Before doing the spill kit procedure, use PPE. Open the super absorbent pack and sprinkle entire content of absorbent material entirely over the bloody fluid. Let it dry until 3 minutes. Add 200 ml of water into the bottle to dissolve the tablet. Use a scoop scraper to pick up material and put into biohazard bag. Pour the solution entire the spill. Use disposable wiping cloth and discard. Remove all PPE and dispose to yellow biohazard bag. Close the biohazard bag using fastener to avoid leaking.
I have learned that acquiring the virus will not stop me to continue life. Be happy of whatever life will give you. Accept who you are. The world will accept you.
I can almost see it, that dream I'm dreaming, but there's a voice inside my head saying you'll never reach it. Every step I'm taking, every move I make feels lost with no direction. And my faith is shaking, but I gotta keep trying. Gotta keep my head held high. There's always gonna be another mountain. I'm always gonna wanna make it move. Always gonna be an uphill battle. Sometimes you're gonna have to lose. It ain't about how fast I get there. Ain't about what's waiting on the other side. The struggles I'm facing, the chances I'm taking, sometimes might knock me down, but no, I'm not breaking. I wanna know what's on your mind, baby, can you tell me? We are such a mystery, mystery. I see you baby, and I can't take this no more. Baby, can you tell me how you
this is the result.
Doctor will come later. The vital signs is okay now. I will.
Hello, good morning, sister. From DR, I'm a children patient, primary gravida, PVDP, 38 weeks.
I have learned that acquiring the virus will not stop life to continue life.
Then you just drop there.
I was 24-year-old back then.
Tissue!
هذا وجهك كده؟ زوجك شغال يا منيرة؟ طيب يا منيرة